Welcome to the program. It's a pleasure to have you here with us. Today, on Doctors on Air, we'll be talking about meningitis. It's a condition that can't wait, and early detection saves lives. Today, we have Dr. Ndidi Nwosu from St. Kizito's Hospital, as well as Mrs. Ajoke Braithwaite and Mrs. Abi Sowemimo on the program. They're both people who have lost dear ones to this terrible condition. You're all welcome.
Thank you.
Thank you so much.
If I can kick off with you, Dr. Nwosu, can you tell us all about meningitis? What is it? Why do we need to know about it?
Thank you so much for that question, and it's an honor to be here. Quickly, meningitis refers to inflammation of the meninges. Each time you see itis in a word, it means infection of or inflammation of. And meninges is the membrane that is the covering of the brain. So meningitis just means infection or inflammation of the covering of the brain.
Now, what are the things that cause meningitis?
And a lot of things. We have viruses, we have bacteria, we have fungi.
So which would you say are the most dangerous, of all of these that you're talking about?
They are all dangerous, but some are worse than others. The common ones is the viral meningitis, and commonly we have herpes virus that causes meningitis. But the one that has the greatest fatality is bacterial meningitis, and the biggest monster, as it were, is Neisseria meningitidis. There are over 13 species of Neisseria meningitidis that causes meningitis, but 4 are quite common here in Nigeria.
It's very interesting because meningitis is something that occurs all around the world. But in Nigeria, it seems, or in Africa, it seems to be more common. Is that correct?
Yes, because in the past, I did say many bacteria cause meningitis. So it's not just the meningitis caused by Neisseria. You have meningitis by streptococcus, you have meningitis by Haemophilus, and these are common bacteria that we find in the tropics. So when you add all that plus Neisseria meningitidis, that's a lot of meningitis. And we didn't have vaccinations that were covering these bacteria in the past. So the number of people that suffered from them, added to the fact that we also are found, Nigeria is located in the so-called meningitis belt. So we also have that crowd of people having meningitis.
Okay. So can you tell us a bit about the symptoms? What kind of symptoms do people get when they have meningitis?
So like every infection, there's fever. It could be headaches, severe headaches. Depending on what's causing it, you have these symptoms that is associated with the part of the body where this bacteria is located. Neisseria meningitis, for instance, stays naturally around the throat. Some people will have it there and not have any symptoms at all. So when it now penetrates the membrane and then goes to the head, you now have Neisseria meningitis. But streptococcal infections cause pneumonia and flu-like symptoms. So that means you have fever, you have flu-like symptoms, you could have vomiting when the meninges have been affected, and there's this severe vomiting. Then neck stiffness is a very that's the one that makes it very clear to everyone that, oh, this is not just malaria, this is not typhoid, this is not a respiratory tract infection, this is meningitis. But before it gets to that point, the symptoms are very common. And that's why that's the problem.
It's actually such a dangerous condition.
Yes.
Because it's just, everybody will think, oh, that's malaria. Or that's just a headache. And what's actually very interesting is just recently, I was at the Eco Health Convention, and the Commissioner of Health, Professor Abayomi, said clearly that now malaria is not as common in Lagos anymore. And that when there's a fever, please do not assume it is malaria. That we need to get tested, because the fever now is more than malaria. It's not just malaria, because a lot in the past, a lot of people just go to the pharmacy, buy malaria tablets, and then they don't get better, and then they wonder why. But now he says, don't assume it's malaria anymore. It's a lot of other conditions. And it seems like meningitis could be one.
Exactly. I also forgot to mention another common bacteria that could cause meningitis, TB. So some could also have tuberculous meningitis.
So how quickly does meningitis become life-threatening?
Very quickly, hours within that same once it gets worse, a person could actually pass on if nothing is done immediately. So as soon as you have the suspicion that someone has meningitis, you need to act fast and start treatment immediately.
Very, very,
Unfortunately, because the symptoms are so, vague, one has to be ready to do what they need to do.
Now, you mentioned treatment, and you actually mentioned prevention, which is something we are very focused on in this program. In what ways can meningitis be prevented?
So for us, we have a responsibility to, it's an airborne disease, it's a contact disease. So if we actually practice good hygiene, it helps. Picking our nose and things like that would introduce pathogens into our bodies, and we don't know if what you're picking is one of the organisms that would cause meningitis. So if we practice good hygiene, wash our hands regularly with soap and water, and don't practice overcrowding as much as possible, that would help.
Everybody.
However,
however,
you can't.
Are the other ways that we can?
However, no matter how much you take care, the bacteria is really small. So, the number one thing that would help is vaccinations, immunizations, and we're so happy to see that for some of the organisms, the vaccines are now available in the routine immunization schedule for the country. Unfortunately, we don't have the big monster yet for those of us that were not vaccinated when we were young. And those are still the people that are at risk in having the disease. So we do need immunization, vaccinations for Neisseria, for strep, for Haemophilus influenza.
So when we talk about vaccination for people, who's at risk? Do we have enough vaccines in the country for people, for the young people who get the condition?
We recently introduced the 5-strain vaccine, but we don't have enough yet. It's not yet out there for everyone. And it's very expensive if you try to get it, by yourself. I'm happy to see that at least we have the opportunity to provide those vaccines. But the money makes it impossible for us to have everyone vaccinated. And everyone needs a vaccine from the infant to the elderly. So there's no one that shouldn't have the vaccine. So we don't have enough, as it were. And that's something that we can actually work towards, seeing how we can improve vaccination and improve herd immunity.
Okay, so when we want to talk about conditions, I'd like to actually talk to our people about this. But the question or the important thing is that if a person has or suspects meningitis, they shouldn't go to the pharmacy, they need to go to the hospital. What can someone do if someone is listening to this program and think, you know what, I think somebody has, the person close to me or whatever has something that sounds like this? What do you advise them to do?
I would advise that if anyone is feeling sick, having a fever, having headaches, see your doctor. You've heard about this. Also talk about your fears. If you think that you've been exposed to someone that's had meningitis, or you feel that this is not malaria and you want the doctor to investigate more, it's important that you actually tell your doctor that you want to check for meningitis, having heard what we've discussed today. Because if we don't think about it on time, then we reduce the time that we can act to change the situation. I remember I had a child that was sent to us on a medical outreach, and immediately I saw the child, I said, no, this is something that has to be handled in the hospital. And the mother was not eager to send the child. I made sure she had my number so that we could talk, and to God be the glory, she finally did. And yes, she did have meningoencephalitis, and they managed her quite well. Unfortunately, because she had had a long waiting time before then, we're still struggling to see how much of the complications would abate before she'll feel better. So, but at least the child, the 2-year-old, is alive today. So I know as soon as you feel that someone has any illness that's kind of looks like it's not malaria, it's not typhoid. Even if you've treated that, it's not working, don't waste time. Don't say, let me wait for 1 week or something. Within those first 2 days, please go ahead, because if it is meningitis and person goes into a coma, then it becomes more difficult to resuscitate. So it's important that we solve the problem early.
I think it almost becomes impossible once they become comatose, from what I've seen. So it's so important that we catch this condition early. So what you said was very important. You said we can treat meningitis, but there are complications that happen afterwards if we don't treat in time. So number one, it can be cured, and number two, it can be it can be treated, it can be prevented, and it can be treated. And I think that's so important that we bear that in mind. Thank you very much. Thank you once again for coming on the program. Mrs. Braithwaite, you have a special foundation called Boom for Good. Can you tell us why you started that foundation?
Yes, thank you very much, Dr. Pamela. Boom for Good was born out of a loss of my daughter, and she died in 2014 to meningitis. I discovered that meningitis is a deadly disease that can take lives within like 24 hours. And unfortunately, we experienced that in our family. Temi was sick, like flu-like sickness for like a couple of days, because I spoke to her like 2 days before that she had flu. And it wasn't anything serious, because that very day she escorted her flatmates downstairs in the lift to, and waved them goodbye. And she was supposed to leave the next day, as there was the last day of the end of the first semester at university. And unfortunately, I tried calling her that day and the next, no response. And a cleaner opened her room to clean her room, and they found her in bed. Unfortunately, she had passed. So that was our first knowledge of her passing. It took a few days when the coroner's report pointed that it was meningitis. So that was where we started our journey from. And the thing about Temi is she's such a precise girl. One of the things that was mandatory when she was going to university was that she had to take the meningitis C vaccine, because it was mandatory for everybody to do. She took herself there without even the parents, us being aware, and she took the meningitis vaccine C. The coroner's report showed that she died of the Y strain meningitis, which says that there are different strains to the meningitis. The fact that you have been vaccinated against one doesn't mean that you can't get the other, which unfortunately we found out. And the interesting thing about meningitis is the year before, my oldest child, who is a boy, also had meningitis, a year apart, different universities. So it's not something that was done, it's contagious like that. So, and when I asked the coroner, what are the odds of two children from the same family having it? And he just simply said, bad luck. I don't know whether I believe in bad luck. I just believe sometimes fate is what happens to one in life. So from that experience, we said, look, we were blessed to have one child survive, but unfortunately we lost one. God has a message in this for us. And that was why we, as a family, got together and said, look, we want to help other family members that ever even getting meningitis or living with the illness from meningitis. The best way to cure it is by preventing it, which is through the vaccination, which is why we set up both out Meningitis for Good Foundation, which our primary aim is to get as many people vaccinated with the ACWY strain of the vaccines. So
that's the pentavalent one.
Yes, exactly. Yes. So that if, like the doctor said earlier, if we can have the herd mentality, herd immunity, then the likelihood of more people dying will be slim. So that's what our foundation really is about. And of course, spreading awareness, bringing it to especially my darling youth to know that it's actually for them, because it's very, very common at the age of about 16 when people are going to university. They call it a lover's illness, actually, because for some, apparently, we're all carriers at the back of our throat, but through kissing or coughing or sneezing, it's actually you can actually get it as well. So it's quite prevalent among the youth as well. So we're trying to.
And it's very interesting, because when I look back even on my own university days, I remember, one or two people, they say, oh, this boy just died in bed. And, normally, unfortunately, all of people say, they're taking drugs. But they said this guy was a strong SU. And so that always stuck in my memory. I thought, this guy was a strong SU. He would not be taking drugs. Everybody knew him for carrying his Bible everywhere. He would not say, what happened to him? How come he just suddenly died like that? And now, looking back on it, I'm almost certain it was meningitis, because this thing seems very common for young people just as they're going into university and spending time in university. So it's so important that the young people themselves are aware of it.
Yeah, very.
It is. So, Kev, I can just hear from you. Abi, can you share with us your experience and why, you're here to share your own experience with meningitis?
Okay, thank you so much for having me. Heads up, like I always say, sometimes I get emotional about this. So we go back to the first time we heard of meningitis in the family was, I think, the 70s, when my sister went for NYC in the north, I think in a place called Malamfashi, Kaduna State. And, she sent back, that time was telegram days. So she sent back a telegram saying that, there's a lot of meningitis here. We didn't know what meningitis was. So I'll fast forward now to 2004, because we lost two nieces back to back, 2004, 2005. And the first niece in the UK, and her mum called to say she had a headache. Okay, headache, go to the hospital. And the headache went on for like 2 days. They gave her drugs, they sent her back. Then she went to ENA and they said, oh no, it's okay, just go back home. And after about 3 days, it was so bad. They said maybe it was a tumor. Then they now said, malaria. Has she ever been to Africa? I said, she's never been to Africa. I said, okay, so let's rule out malaria. Then they said it could be a form of, I think they were saying maybe brain tumor or something like that. Let's do some tests. But it was while they were doing the test that she slipped into a coma. And so she said she's gone into a coma. This is 18-year-old, bright girl, slipped into a coma. What happened? While they were saying slipped into a coma, she passed on. And this was very painful for us, because you're thinking a young, bright young lady with a headache, and then slip into a coma, and that's it. So like Mrs. Braithwaite said, until we had the coroner's report, they said meningitis. And our first, was meningitis in the UK. Yeah. Is it there? Maybe we were thinking like lay people, but we never thought that there was meningitis in the UK. Our idea was that, okay, there's meningitis in Africa. There's meningitis in Nigeria, but it's in the north. It's not even in the south of Nigeria. So we mourned that, 2004. Then come 2005, April to be precise. A young niece, she had just come back from a holiday. She was just going to be 13, so everyone was excited, teenager and everything. So she came back on a Friday, and by Sunday, she said she had a headache. And the first thing, we said, okay, what kind of headache? So, no, it's just a headache. So quickly to the hospital. And I'm sorry, but in Nigeria, when you go to the hospital, 2004 also, it's, you have malaria. So they're treating you for malaria. So after 2 days, malaria doesn't go. Then they're treating you for typhoid. So we've lost what? We've lost 4 days. And she kept on saying, this headache is much. And then we said, okay, when we went to the hospital, do you have a stiff neck? No, there's no stiff neck. Okay, so we're just fine. Then the hospital where she went to said, you know what, there's a hospital in the mainland, take her there, and then they'll be able to see her properly. And they took her there, and we saw, when we spoke to my sister, this is the same thing that she saw. So we said to the medical director, please test for meningitis. And he got upset. And he said, you can't teach me what to do. This child doesn't have meningitis. Blah, blah, blah. He just went on, and we were upset. But that's how he went. 2 days, 3 days, and she slipped into a coma. Now, by the time she slipped into a coma, these things just flashed back. It just flashed back. And we were saying, hi, we've had a family member go through the same thing. This is it. Please test for meningitis. But I think, doctor, by the time she's in the coma, I don't know whatever test they can do. But by the time she was in a coma and we saw her crying, we knew that that was the end, because that was the same thing that happened to Lou in the UK. So by the time she started to weep in the coma, we knew that we had lost her. And it didn't, I think the World Meningitis Day was 2009, but we were bitter. Did we have to wait that long to know that, this meningitis is a scourge that people should know about? We wanted to sue the hospital, but if you sue the hospital, it won't bring her back. Do you understand? So that's why I said, I like what you're doing. We need to have more awareness of meningitis. And doctors should please stop this thing of treating malaria first when you go to the hospital for a headache. No. If they say to you, we've seen these symptoms before, at least give us, the lay people, benefit of doubt. Even if we're going to look stupid at the end. But listen, we've done the meningitis test, it's not it. At least our mind is at rest. But you can't throw us away because we're lay people and we can't tell you what to do. So our pain was that we lost people back to back, 2004, 2005, because they didn't listen to us.
But, it's interesting because we say in Africa, Nigeria, in the UK as well, where my daughter died, they're not as knowledgeable as they really should be for an advanced nation. My first child that had it also, it was the luck, because the doctor was clued in. He knew what signs to look for that saved his life. Yeah. So the important thing for us as a foundation also is to try and educate the doctors themselves. I think they need to know a bit more. So one of the things that we're doing in our foundation is putting flyers in doctors' rooms, reception, so that they are also, they know what signs to look out for, not just like, unfortunately, that what happened to you where you're just testing for A, testing for B, test for it, because he had to take 7 injections, in fact, it's very long injections in his spine. Mm-hmm. So, he didn't want to take it because he has needle phobia. Yeah. But he did, and he's alive to tell the tale today. So it's important for us to...
It is important to know that, but also, I think it's also important to be fair, to know that the symptoms are not clear.
Yes.
And so it is not so straightforward. And that's why it's so important to have programs like this that raise that index of suspicion. Yeah. Now, we have, unfortunately, not much time left. So I'd like to just have us give our last words for our listeners. If I can start with you, Mrs. Braithwaite, can you give us, because I know there's a lot of work your foundation has done, and we might have people out there who want to support your foundation. Can you perhaps give us a phone number that people can reach you on if they want to support the foundation, particularly since we know the vaccines are expensive, 35,000 naira for one. It's not an easy task that you have. So can you share with us?
Yes, thank you very much. You can support us through our website, which is the www.boomforgood.org. You can just click on the link and you'll be able to help sponsor us. You can just buy one vaccine for 35,000 naira, and that means you've saved a child. Like somebody broke it down, a couple of ashwebis a year will pay for meningitis vaccines. And you can reach us on our telephone number, which is 0909 70 210.
Thank you. Abi, any last words?
Like I said before, I know you said it, that it's not straight cut when you have meningitis. But I think doctors now should be aware that when people come in, let's do all the tests. Let's everything, not just the malaria, the typhoid, but a child comes in with a headache and the headache doesn't go after 2 days. Please go straight into the meningitis treatment.
Dr. Nwosu?
I'd like to thank you for having this program and to raise the awareness for meningitis. And I want to say that let's all get immunized. That's the way to go. If we're waiting to treat when someone actually has meningitis, even doing the test is very invasive. You can have a lot of complications even from running the test for meningitis, which is why doctors are not in a hurry to start doing invasive spinal taps for every headache that comes in.
Yeah.
But if we have done our vaccines, if we've had our vaccines for all the causative organisms, then we've actually gone a long way. So let's support Boom for Good and the hospitals that are helping us to get those vaccines across.
Thank you. Thank you very much. Thank you for watching. Please like, share and subscribe for new video updates.